All right, so get this. More men actually want a larger penis
Wow.
than they want to be taller.
Really?
Yeah, I know, right? It's pretty wild.
That's interesting.
You sent me this really fascinating YouTube video
Okay.
by Dr. Rena Malik.
Mm-hmm.
She's a urologist,
Okay.
and she breaks down all the science of penile girth enhancement.
Okay, cool.
And apparently, one study she cited said that 45% of over 26,000 men
Wow.
wanted a bigger penis,
Wow.
while only 38% wished they were taller.
It really makes you think about how we define masculinity, doesn't it?
Yeah, it really does.
Yeah.
It's like, what does it even mean anymore?
Right.
And the thing is, there are a ton of options out there for these guys.
Like what?
Like pills and devices and even surgery.
Oh, wow.
And it can be a real jungle to navigate.
Yeah, for sure.
So whether you're like prepping for a consultation or just curious or somewhere in between,
Okay.
we're going to break down Dr. Malik's insights and try to figure out what actually holds water.
Sounds good. I really appreciate about Dr. Malik is that she cuts right through the BS.
Yeah.
She's all about evidence-based stuff, which is really refreshing in a field that's often,
Totally.
riddled with, let's just say, creative marketing.
Absolutely. Yeah, a lot of snake oil out there.
Exactly.
So first things first,
Yep.
Why are so many men even seeking girth enhancement in the first place?
Right.
Dr. Malik points out that a lot of guys overestimate what's even considered normal size.
Yeah.
And some studies even show that up to 91% of men
Wow.
think their penis is too small.
That's fascinating, isn't it?
Yeah.
You'd think with all the information out there these days,
Right.
we'd have a better grasp of reality.
Right.
It really speaks to the power of societal pressures and how they warp our self-perception.
It really does make you wonder, is this like a body image issue? Are we
Man.
talking about body dysmorphia here?
Well, Dr. Malik does touch on that.
Okay.
Yeah, it is a real concern. But studies suggest that true body dysmorphia only affects about 10–15%
Oh.
of men who are seeking enhancement.
Gotcha.
So it's definitely part of the conversation, but there's more to it than that.
Okay, so if it's not just body dysmorphia,
Right.
what else is driving this desire?
Well, it's complex.
Mm-hmm.
You got confidence, aesthetics, sexual function, partner satisfaction.
Okay.
It's rarely just one thing.
Yeah.
Think about it. Society puts all this pressure on men to be big
Right.
in so many ways.
Right.
And Dr. Malik even compares it to the pressure
Okay.
that women face with breast size.
That's a really interesting
It's
comparison.
a whole societal thing.
For sure. For sure. Okay, so let's get real for a second.
Okay.
What about all those pills and gummies that are flooding the market?
Oh, yeah.
You know, the ones that promise to, like, make you bigger naturally.
Ah, yes, the natural male enhancement industry.
Right.
It's a multi-billion-dollar business built on hope
Uh-huh.
and very little science.
Yeah.
Dr. Malik is very clear on this. There is no credible scientific data to support the claims that these products make.
Yeah.
They're not FDA approved,
Mm.
and some could even be dangerous.
Hold on, dangerous. Like, what kind of dangerous are we talking about here?
Well, it really depends on the product and the ingredients.
Okay.
Some might just be ineffective,
Okay.
but others could contain substances that interact badly with medications or have unknown long-term effects.
Wow, that's scary. I mean, it's shocking that this industry is projected to be worth almost $600 billion by 2025.
Yeah, it is a staggering figure, isn't it?
Yeah.
It really underscores the importance of critical thinking and seeking out evidence-based information.
Absolutely.
Don't fall for the hype.
Totally agree.
Yeah.
Okay, so let's move on from the quick fix scams
Okay.
and dive into like the real science of girth enhancement.
Sounds good.
Okay, so Dr. Malik reviewed 29 studies on different methods.
Okay.
But here's the thing. She emphasizes that most of these studies were really small
Okay.
and short term.
Okay.
Drawing definitive conclusions is tough.
Right. You always have to consider the limitations of the research.
Yeah.
A small study means fewer participants,
Right.
which can make the results less reliable.
Okay.
And short-term studies don't tell us much about the long-term effects
Yeah, that makes sense.
or sustainability.
Okay, so even with those limitations, what did Dr. Malik find?
Okay.
Let's start with vacuum devices.
All right. So these devices work by creating negative pressure,
Okay.
which supposedly draws blood into the penis,
Okay.
causing a temporary increase in girth.
Right, it's like blowing air into a balloon.
Exactly.
It doesn't last.
Exactly. Studies show that while vacuum devices might offer like a temporary boost,
Okay.
they don't lead to any permanent changes in
Yeah.
girth.
Okay.
Plus, user satisfaction tends to be pretty low.
Makes sense. What about traction devices?
Okay.
We talked about those in our episode on length enhancement, right?
Yes.
Do they work for girth too?
Well, traction devices primarily focus on lengthening the penis
Okay.
by applying consistent tension over time. Their impact on girth is less clear-cut.
So let's move on to something a little more invasive.
Okay.
Injections. Dr. Malik talks about fat injections,
Okay.
which on the surface sound kind of appealing. It's your own body fat.
Uh-huh.
So theoretically, less chance of rejection.
That's the idea.
Okay.
But the reality is a little more complicated.
Okay.
Fat injections for girth enhancement come with their own set of risks.
Like what?
Well, for one, the results can be unpredictable.
Okay.
You don't always get even distribution, which can lead to lumps and deformities.
Okay.
And then there's the risk of serious complications.
Okay.
One study that Dr. Malik cites reported complications in 2.3% of patients.
2.3% doesn't sound too bad.
It might not sound high,
Okay.
but when you're talking about a procedure that's not medically necessary,
Right.
any risk has to be carefully considered.
Okay.
Plus, remember that 2.3% includes a range of complications,
Yeah.
some of which could be quite serious.
Okay, so what are some of those serious complications?
Well, one of the most concerning is fat embolism.
Okay.
That's when fat enters the bloodstream and travels to the lungs or the brain,
Okay.
which can be fatal.
Wait, fatal?
Yeah.
You're saying someone could actually die from a fat injection for penile girth enhancement?
Unfortunately, yes.
Wow.
Dr. Malik even mentions a case where a patient died due to a fat embolism after this procedure.
Wow.
It's a tragic reminder that even seemingly simple procedures carry risks.
That's incredibly sobering. Okay, so maybe fat injections aren't the best option. What about silicone?
Silicone has a long, and let's just say colorful, history.
Colorful? What do you mean?
Well, it was first used for this purpose back in the 1940s.
Oh, wow.
But despite decades of use, it's still not considered a safe or reliable option.
Why not? What's wrong with silicone?
Well, the problem is that injecting silicone directly into the penis
Okay.
can lead to all sorts of complications.
Okay.
Think about it. Silicone is a foreign substance.
Right.
Your body doesn't always react well to it. It can cause chronic inflammation leading to swelling, pain, and even distortion of the penis.
Ouch, that sounds awful.
Yeah.
And what about those silicone granulomas I've heard about?
Yes, those are a real concern.
Yeah.
Granulomas are basically hard lumps that form around the silicone
Okay.
as your body tries to wall it off.
Gotcha.
They can be painful and disfiguring,
Okay.
and removing them is often difficult and can lead to further complications.
So we can cross silicone off the list too.
Yeah, really good idea.
What about fillers?
Okay.
Those are pretty popular for other cosmetic procedures like lip injections and wrinkles.
Right.
Are they a viable option for girth enhancement?
They are being used, yes, but as with any procedure, there are trade-offs.
Okay.
One of the most commonly used fillers is hyaluronic acid, which is naturally found in the body.
So it's safe, right?
Well, it's generally considered safe,
All right.
but remember, we're talking about injecting it into a very sensitive and delicate area.
Right.
While it can initially provide a good girth increase, there are some potential downsides.
Like what?
Some patients report decreased sensation after hyaluronic acid injections.
Okay.
And then there's the issue of firmness.
Okay.
The penis might not feel as firm as it did before the injections.
That doesn't sound ideal.
Yeah.
Anything else I should know?
Oh, and one more thing. The effects of hyaluronic acid aren't permanent.
Right.
So you need repeat injections to maintain the results,
Okay.
which can get expensive and increase the risk of complications over time.
Okay, so it's not like a perfect solution.
Wow.
What about other types of fillers?
Well, there's polymethyl methacrylate, or PMMA,
Okay.
which is a more permanent filler.
Permanent. That sounds promising.
It does, but there's a catch.
Okay, that's always a catch.
PMA has a much higher rate of cosmetic issues.
Okay.
We're talking about things like nodules,
Uh-huh.
bumps and ridges forming under the skin.
Okay.
Not exactly the smooth, natural look most guys are going for.
Yeah. That's a bummer. And can you remove PMA if you don't like the results?
Removing PMMA can be very challenging,
Okay.
and in some cases impossible, without causing significant damage to the surrounding tissue.
Okay, gotcha.
So it's definitely a decision that shouldn't be taken lightly.
So we've covered non-invasive options like vacuum devices and traction devices.
Right.
And we've delved into the world of injections, from fat to silicone to fillers.
Right.
But there's one big category left to explore.
And what's that?
Surgery.
Ooh, and this is where things get even more complex.
Yeah.
And the risks become more significant.
All right, well, buckle up, listeners. We're about to get into the nitty-gritty of surgical girth enhancement.
This should be good.
Stay tuned for part 2 of our deep dive, where we'll explore the different surgical techniques,
Right.
their potential benefits,
Okay.
and of course the risks involved.
Can't forget about those.
Oh, don't go anywhere. Welcome back to our deep dive into penile girth enhancement.
Now, before we jump into the surgical options, I think it's important to step back for a second
Okay.
and remember that this isn't just about physical size.
Yeah, you're right. We've been focusing a lot on like the nuts and bolts of these procedures,
Yeah,
but there's a whole psychological and emotional side to this too.
exactly. A lot of men seeking girth enhancement.
Right.
They're looking for a boost in confidence and self-esteem.
Which is completely understandable.
Right.
But like, wouldn't you say that it's important to figure out if enhancement is really addressing the root of the issue?
Absolutely.
Like, what if the confidence issues are coming from somewhere else entirely?
That's a crucial point.
Yeah.
It's like putting a bandage on a broken bone. It might cover it up, but it doesn't fix the underlying problem.
So what's the solution then?
Open communication.
Okay.
And I don't just mean talking to a doctor about the procedures.
You mean talking to your partner?
Exactly. This isn't just an individual decision.
Right.
It affects relationships
But
too.
sure.
Imagine going through a procedure without your partner being on board,
Right.
or even understanding why you're doing it.
That could create a whole new set of issues.
Absolutely. Talking openly about expectations, concerns, and potential outcomes.
Right.
It can actually strengthen a relationship.
Okay.
It's about making a decision together,
Right.
not in isolation.
That makes a lot of sense. And speaking of expectations,
Yeah.
I think it's worth mentioning that girth enhancement doesn't magically solve all relationship problems.
Definitely not. It's not a cure-all for deeper issues that might exist.
Right.
You know, sometimes dissatisfaction in a relationship, it might stem from communication breakdowns, intimacy issues, or even unresolved conflicts.
So what you're saying is if someone's considering girth enhancement to
Right.
like fix a relationship,
Right.
they might be barking up the wrong tree.
It's important to be honest about the motivations.
Yeah.
If there are underlying issues in the relationship, addressing those should be the priority, not just focusing on physical changes.
And how do you suggest people address those deeper issues?
Therapy or counseling can be incredibly helpful.
Yeah.
It provides a safe space to explore those emotional needs
Right.
and work towards a healthier, more fulfilling relationship.
Right. It's about working on the foundation, not just the facade.
Exactly. And on that note, let's not forget the importance of self-acceptance
Oh, absolutely.
and body positivity.
We live in a world where we're constantly bombarded with images of ideal bodies.
It's true.
You know, it's so easy to get caught up in those comparisons and feel insecure about our own appearance.
Yeah, but true confidence comes from within, right?
Exactly.
Appreciating your body for what it is.
Yeah,
And focusing on what truly matters.
I love that. But how do you cultivate that self-love
Right,
when you're constantly being told you need to be bigger,
right.
better, more?
It's not easy, that's for sure.
Yeah.
But there are things you can do,
Right.
surrounding yourself with positive influences, challenging those negative thoughts, practicing gratitude for your body.
Okay.
These are all steps in the right direction.
And if those steps are enough?
There's absolutely no shame in seeking professional help.
Okay.
Talking to a therapist can provide tools and strategies
Okay.
for overcoming those negative thought patterns and building a more positive self-image.
So even if someone ultimately decides to go ahead with girth enhancement,
Right?
having that strong foundation of self-love and acceptance is crucial.
Absolutely. It's about making a choice from a place of empowerment,
Right.
not desperation.
All right, so we've talked about the emotional and the psychological aspects, but we still haven't tackled the big one,
What's that?
surgery.
Oh, yeah. You ready to dive in?
Let's do it.
Okay.
Yeah.
Now keep in mind,
Okay.
surgical girth enhancement is a serious decision.
Okay.
The risks are higher than with non-invasive or minimally invasive options,
Right.
and the recovery can be more challenging.
Okay. So listeners, if you're squeamish, maybe skip ahead a few minutes.
Yeah.
But for those who are curious, let's break it down. What are the main types of surgical procedures for girth enhancement?
Well, one common approach is using grafts.
Okay.
This involves taking tissue from another part of the body,
Okay.
like the groin or the abdomen, and using it to increase the circumference of the penis.
So they're basically adding bulk by transplanting tissue.
Exactly. But as you can imagine, this is a pretty invasive procedure.
What are some of the risks involved?